This is Air It Out, where we talk about life with asthma. Be sure to like and subscribe. Hi guys, welcome to Air It Out. Today I have something super cool for you guys who are living with asthma. Now, as we all know, asthma does not care if you're at the movies, heading into a job interview, whatever. Those attacks can happen anywhere, anytime. And that's why we all know it's important to carry our rescue inhalers. So actually, that's what I want to talk to you about today. You might be familiar with albuterol, the medicine that's in many rescue inhalers. But this rescue inhaler, AIRSUPRA, is a little bit more modern. It contains albuterol, and it also contains a medicine called budesonide, which is an inhaled corticosteroid to help decrease inflammation in the lungs. AIRSUPRA is for oral inhalation only. As you can see, this is the box it comes in, and right here behind the flap, you'll find a QR code that you can scan to visit airsupra.com and learn more. This is only on the box, not on the inhaler itself. So let's unbox. If this is your first AIRSUPRA inhaler, you probably want to know how to use it, rinse it, and store it. Good news, people, I'm gonna go over all of that here. So this is AIRSUPRA. Let's get to know it. This is the pressurized canister, which holds the medicine in the inhaler. And right here, you have the puff indicator with this pointer here, which identifies how many puffs are remaining. The puff indicator will count down by 1 each time you spray a puff of medicine. It's color-coded. Yellow means you should order a refill ASAP, and red means it's time to throw out your inhaler. And here is the actuator, which holds the pressurized canister. This is the actuator label, which you'll use to record the use-by date of your inhaler. This is the mouthpiece, which sprays the medicine. And finally, here is the mouthpiece cover, which protects the mouthpiece when your inhaler is not in use. Now that you understand the basic components of your AIRSUPRA inhaler, it's time to dive into the really important stuff. Let's prep the device. First things first, you're gonna write the use-by date right on the actuator label. That's going to be 12 months from the date you open the foil pouch. Use a permanent marker so it doesn't rub off over time. Now that you've marked the use-by date, let's get priming. This step is super important the first time you use your inhaler. First, take the mouthpiece cover off. Then, shake the inhaler well. Hold it facing away from you and press firmly on the puff indicator. This sprays a test puff. You'll have to shake and repeat priming 4 times total. This makes your inhaler ready to go. In some cases, you'll need to reprime the inhaler with 2 test puffs. If the inhaler is not used for more than 7 days, if you've dropped the inhaler, or after rinsing the white actuator. That concludes the preparation for the inhaler. Let's see how we actually use it. First, remove the mouthpiece cover and check that the inside of the mouthpiece is clear. Next, you should shake the inhaler well and breathe out fully. Place the mouthpiece into your mouth and close your lips around it. As you start to breathe in deeply and slowly, press the canister once to spray a puff. Keep breathing in until you cannot anymore, then remove the mouthpiece from your mouth and hold your breath for as long as you can, up to 10 seconds before breathing out. Immediately repeat the shake and inhale step to take a second puff. This completes 1 full dose. Remember, do not use more than 6 doses or 12 puffs in 24 hours. After you've taken 1 full dose, replace the mouthpiece cover and rinse your mouth with water if available. Don't swallow it, just rinse. And that's how you take AIRSUPRA. But we aren't finished yet. Let's talk about cleaning and care. Let's talk about how we keep that inhaler squeaky clean. It's important to rinse the actuator weekly so the medicine does not build up and block the spray through the mouthpiece. First, remove the canister and set it aside. You definitely don't want to get this wet. Then take the cover off the mouthpiece. Rinse both ends of the actuator with warm water for 30 seconds on each end. You absolutely never want to use any type of soap for this. Water only. Once rinsed, shake off as much water as you can. Look inside the mouthpiece and the actuator to ensure there is no buildup. If you find any remaining buildup, repeat the weekly rinse step. Do not dry with a towel or tissue. Let the inhaler fully air dry before reassembling, which can take place overnight. Once it's completely dry, you can reassemble your inhaler. First, place the mouthpiece cover on Then gently press the canister down into the actuator. Do not insert the canister while the mouthpiece cover is off. Reprime with 2 test puffs. Make sure to shake the inhaler before each test puff. If for any reason you have an emergency and must use your inhaler when it is still wet, be sure to shake off as much water as you can. Insert the canister into the actuator and make sure to do 2 test puffs into the air away from your face before taking your dose. Take your dose, then repeat the rinsing steps. We've covered the essentials, priming, using, and rinsing AIRSUPRA, but proper storage is also important. Let's talk about storing your inhaler. Remember, always keep your inhaler clean, capped, and stored between 68 and 77 degrees Fahrenheit. Don't keep it anywhere humid, such as a bathroom, and make sure to keep your inhaler out of reach of children. You should order another inhaler when the pointer on your inhaler puff counter is in the yellow zone, when the indicator reaches 0 puffs remaining, or it's been 12 months since you opened the foil pouch, whichever comes first. Throw your AIRSUPRA inhaler in the household trash and order a new one. Okay guys, you're all set. Don't forget to bookmark this page in case you need a refresher. Please continue watching until the end of the video for additional important safety information that you'll want to know about AIRSUPRA. Remember, this information does not take the place of talking to your healthcare provider. So if you have any further questions about AIRSUPRA, you can talk to your doctor or pharmacist or call 1-800-236-9933.
Important safety information. Do not use AIRSUPRA if you are allergic to albuterol, budesonide, or any of the ingredients in AIRSUPRA. Before using AIRSUPRA, tell your healthcare provider about all your medical conditions and about all the medicines you take. A dose of AIRSUPRA is 2 inhalations, puffs, as needed. Use AIRSUPRA exactly as your healthcare provider tells you to use it. Do not use more than 12 puffs of AIRSUPRA, which equals 6 doses, within a 24-hour period. AIRSUPRA is not to be used as a maintenance treatment for asthma. If you are currently taking medicine long-term to maintain control of asthma symptoms, you should continue to take that medicine as directed by your healthcare provider. Do not change or stop other inhaled medicines or asthma medicines, oral or inhaled, without first talking to your healthcare provider. Call your healthcare provider or get emergency medical care right away if your breathing problems get worse. You need to use AIRSUPRA more often than usual, or AIRSUPRA does not work as well to relieve your asthma. AIRSUPRA can cause serious side effects, including worsening trouble breathing, coughing, and wheezing, paradoxical bronchospasm. If this happens, stop using AIRSUPRA and call your healthcare provider or get emergency medical care right away. This is more likely to happen with your first use of a new canister of medicine. Heart problems, including faster heart rate and higher blood pressure. Possible death in people who use too much AIRSUPRA. Serious allergic reactions. Tell your healthcare provider or get emergency medical care right away if you have a skin rash, redness, or swelling, severe itching, swelling of the face, mouth, or tongue, trouble breathing or swallowing, or chest pain, changes in laboratory blood levels. Low levels of potassium, hypokalemia, may cause abnormal heart rhythms, weakened immune system, and increased chance of getting infections. Fungal infection in your mouth and throat, thrush. This is a common side effect. Rinse your mouth with water if available without swallowing after using AIRSUPRA to help reduce your chance of getting thrush. Reduced adrenal function, adrenal insufficiency. This can happen when you start taking a medicine containing an inhaled corticosteroid, such as AIRSUPRA. Bone thinning or weakness, osteoporosis. Eye problems, including glaucoma and cataracts. Your healthcare provider may suggest having regular eye exams while using AIRSUPRA. Discuss any eye problems with your healthcare provider. Common side effects include headache, cough, and hoarseness. These are not all the side effects of AIRSUPRA. For more information, ask your healthcare provider or pharmacist. Approved use. AIRSUPRA combines 2 medicines to be used as needed as a rescue inhaler in people 18 years of age and older to treat or prevent symptoms of asthma and help prevent sudden severe breathing problems, asthma attacks. Please see full prescribing information and patient information and discuss with your doctor.